How to apply sterile dressings for plumbing wounds. Have you ever wondered how to properly care for a plumbing injury? Cuts and abrasions can happen easily when working with sharp tools or metal edges. Knowing how to apply sterile dressings is essential for preventing infection and ensuring proper healing. Let's walk through the steps together. First, you want to create a clean workspace. Find a smooth, disinfected surface or a stainless steel trolley to work on. Gather your supplies, which should include a sterile dressing pack, sterile gloves, non-sterile gloves for removing old dressings, a wound cleaning solution like sterile saline, adhesive tape or bandages, and an apron to keep yourself clean. Before you start, wash your hands thoroughly with soap and water or use an alcohol-based hand sanitizer. This step is vital to reduce the risk of introducing bacteria to the wound. If there is an old dressing, put on your non-sterile gloves. Carefully remove the old dressing without contaminating the wound and dispose of it safely. Next, it's time to clean the wound. If it appears dirty, gently clean it using your sterile solution. Use sterile gauze or swabs to wipe away any dirt, blood, or debris. Be gentle to avoid causing further tissue damage. Once the wound is clean, put on your sterile gloves. This is important to maintain a clean environment around the wound. Now open your sterile dressing pack without touching the inside surfaces. Place the sterile dressing directly over the wound. Make sure it fully covers the injury, extending at least to 0.5 centimeters beyond the edges of the wound. This helps protect the surrounding skin. If the wound has sutures or is likely to stick, use a non-adherent dressing. To secure the dressing, use sterile adhesive tape or a roller bandage. Be careful not to wrap it too tightly, as this can restrict blood flow. If the wound is bleeding heavily or has drainage, add an absorbent dressing over the first layer. After applying the dressing, keep it dry and intact. Change it according to the condition of the wound or as advised by a medical professional. Typically, you should change the dressing every 1 to 3 days or sooner if it becomes wet or soiled. Always monitor for signs of infection, such as redness, swelling, increased pain, or discharge. If you encounter a deep, heavily bleeding, or contaminated wound, or if you notice signs of infection, seek medical attention promptly. In plumbing, maintaining cleanliness during dressing application is especially important. Plumbing injuries often occur in environments filled with dirt and chemicals. Proper wound care not only reduces downtime but also prevents complications that could interfere with your work. Always prioritize safety by wearing protective gear and keeping first aid supplies readily accessible on site.